So today is our first webinar or meeting around practices in Housing First. And the objective here is to bring people together to talk about how you're delivering Housing First and to create a space where people can ask questions and exchange experiences and practice. I'm going to say a few introductory remarks here, and then I'm going to pass on to Niall at Focus Ireland to take over the moderation of this webinar. But just a few housekeeping bits before we get started. Please, again, let us know in the chat where you're from. It's great to know that we've got people from all over the place. I see old friends from our trainers from Italy as well, so that's great to see you. And just it helps us to sort of feel like we're all together, which is great. As you know, in these webinars, I'm sure most people have been in at least one Zoom webinar by now. We have lots of ways through which you can communicate with us. We're going to ask you to just use the chat today. So not use the Q&A box, just makes it a bit easier for us to manage the flow of questions and information. So please feel free to use the chat to ask questions as we're going through the presentations. And because we'd really like to foster discussion and debate, we're going to use the chat to take questions and pass them to the speakers, but we'd also use the opportunity to call on you to make comments or speak. So even though we can't see you, you can absolutely ask to have the microphone, and we'll turn the mics on so you can have a chance to make a comment or ask a question verbally as well. So we will make sure that's available after the presentations. And again, I'll just say, yeah, welcome. This is yet another new attempt for the Housing First Europe Hub to use this new technology in our times of COVID distancing. But it's really lovely to be able to see so many people joining us this morning. So without further ado, I will hand over to Niall Keane from Focus Ireland, who's going to do our introductions and take us through this morning's session. Over to you, Niall.
Thank you very much, Samara. That's very good. Niall Keane is my name. I'm one of the service managers who work with Focus Ireland here, and I'm primarily based in Dublin. This is the first in a series of webinars from the Housing First Good Practice platform that is scheduled to take place over the coming 18 months. The Housing First Good Practice platform has been pulled together to look at all the different practices in relation to Housing First and how we can use the best of those practices to inform other areas about the best way to I suppose, work in a Housing First way, but also to get the best out of the services that we do run. So for today's topic, Slices of Pie, Housing First practice in a psychologically informed environment. So we have two presentations today. They're going to give us an overview as to what PIE is and how it can work well for organizations that are delivering Housing First. We're also going to explore how PIE was set up in the Scottish context, and I suppose from both presentations, we're going to learn from the experiences of PIE and celebrate some of the successes. And I suppose by way of introduction in our first presentation, we have Ger Spillane. Ger is one of the regional managers here in Focus Ireland, and he's been at the forefront of Housing First service delivery in Focus Ireland. And he currently manages the Housing First services in the Midwest and south of the country for Focus Ireland. He's worked with Focus Ireland since 2012 as a regional services manager, and he has worked in the homeless or non-for-profit agencies at various levels for over 30 years, both in Ireland and the USA. Prior to taking up his role in Focus Ireland, Ger was head of emergency homeless services with Cork Simon Community, and he holds an undergraduate degree in social science, a postgraduate degree in occupational public health from the University of Cork, as well as qualifications in addiction studies. So without further ado, I'm going to ask Ger to present first, and then I can introduce Gary for the second presentation. So over to you, Ger. Thank you.
Good morning, all. Is that okay? Everybody see that? Okay, so I just want to begin by saying that the psychologically informed environment is, I suppose, when you go through it and when Gary and I are talking about it, you'll see that you're doing an awful lot of what a psychologically informed environment is already. So what a psychologically informed environment tries to do is acts as a framework to bring in all the good practices that we are currently using and to enhance and to develop other practices that we need to. In terms of housing first, PI, or a psychologically informed environment, looks at the whole or the totality of the person, their past experiences, their present experiences, and wraps around services and around supports in order to help them to manage and deal with those things. So that's why it's excellent. So I suppose just at the get-go, to start off as to what informs our work and what led us into developing a psychologically informed environment is that some of the stuff I'm saying looks pretty obvious, but first one is that homelessness is wrong. The second thing is that homelessness does not define a person. So, it's a stage in a person's life. Somebody can leave homelessness and we support them to do that. We also bring into consideration the social contract that we have with the people that we share our society with. And the most fundamental part of that social contract is that we look after the most vulnerable people in our society. We also believe that homeless people deserve a quality service. So that's something that came out recently in research that was done in Trinity in a book by Dr. Owen Sullivan, which kind of highlighted the fact that in a lot of places in the sector that homeless people should be happy for whatever service they give. We believe that they deserve a quality service. I suppose another key and fundamental part of having a psychologically informed environment is that we believe that people have experienced persistent and ongoing trauma in their lives from a very young age, and this has a lasting cognitive and physical effects. We also understand that environment plays a key role in interventions. So just to expand on that a little, Robin Johnson, who I've worked with a bit at a psychologically informed environment, he was one of the instigators of PI, and he worked as a psychiatric social worker, and he got to see a lot of visits and multi-agency visits. So he got to see people in different locations, and he questioned why people behave differently in one location. So say, for example, in an emergency accommodation as opposed to a community setting, where the environment, the only thing that changed was the environment and the person's behavior in response to the environment they were in. The other key thing is that people should not be blamed for their vulnerabilities. So in Ireland, and we've had a long history of the deserving and undeserving poor. We've had poor law, and a lot of our modern day policies has been affected by our historical approach to dealing with homelessness and to dealing with vulnerable people. And that, of course, the main thing is that compassion, understanding, patience, empathy are core values of our work. One of the key pillars of psychologically informed environment is evidence-based, or learning and inquiry. So what information is out there, what research is out there that can influence and form our approach to how we work with people who are experiencing homelessness. So one of the key things was, and this came about from research that Focus Ireland had done, that research that Cork Simon had done. And in that research, which was done independently by UCC and other researchers, they found that between 96 and 100% of the people using their service had experienced 4 or more adverse childhood experience. And because of the homeless crisis we have in Ireland at the moment, where over 3,500 children are homeless, that is becoming an adverse childhood experience for them as well. So they're traumatic events. I know a lot of people are probably aware of adverse childhood experiences. So adverse childhood experience has been designated as a public health issue. And you can see that, from the infographic that's there, that, levels of lung disease, levels of attempted suicide, levels of intravenous drug use, you're more prone to engage in that type of activity, the more adverse childhood experiences that you have. And you can see from the kind of the Maslow triangle that it leads adverse childhood experiences, with the end one being an early death. And we know that these adverse childhood experiences, in our experience of working in homeless services, it has been the pathway for people entering into homeless services. So as I was saying, we were going in the research that had been done both in Cork and nationally and internationally, the figures were roughly around what's representative here. So you need 70% of children in foster care, and 93% of homeless mothers have a lifetime history of interpersonal trauma. So the numbers are reflected in the very high, 90s in terms of the effect that adverse childhood experiences have. Now, the thing about adverse childhood experiences is you can't focus on that solely, because the adverse childhood experiences that you experience as a child, usually perpetrated by your parents, it doesn't take into consideration, or at least must take into consideration, the structural inequalities in society that created that environment to exist. So once you accept everything that I've said today, in the last number of slides, is what you do now. So you have all this information. You know that a way of working, and you know that the effects that trauma has on people. So what do you do now? So what we decided to do was we would take on a psychologically informed environment. And this comes from PyLink, which is something you should look at. So at its simplest, a psychologically informed environment has been described as one that takes into account the psychological makeup, the thinking, the emotions, the personalities, and the past experience of its participants, and in the way that it operates. So it looks at the total experience of the person. The other thing what Pi does as well is that the compassion and the empathy and the understanding and the patience that you show to your customers or to your service users, you also show that to your staff. So it's a universal. It's not just the customer you're dealing with. Everybody's involved in this, and all parts of the organization are involved in this. So as I was saying, it's a whole organizational model. In our respects, like that includes fundraising, finance, property, services. Everybody is part of delivering a psychologically informed environment. And that it can't be just done in one piece of the organization because it won't work. It needs to be everything. And Pi influences all areas of the organization. And that is a key part of that. So there's 5 principles. And I mean, my apologies for rushing through this, but we're kind of on a limited time, and we could spend, Gary and I could spend the day talking about psychologically informed environment and how effective it is. So I'm just going to look at one, which is spaces of opportunity. I've kind of already touched on learning inquiry by talking about adverse childhood experiences and all the other research that's out there that enhances our knowledge, that makes our service a better service for the service users that come to use our service. So there's a psychological awareness and a psychological framework. So the psychological awareness is about how trauma affects it. And we've kind of slightly developed our psychologically informed environment by introducing trauma informed as a psychological framework for that. Training support for staff is obviously very important. And then the rules, roles, and responses, and the learning inquiry. But I'm just going to focus specifically on spaces for opportunity. I suppose spaces for opportunity can be, it's the physical space, and it's a thoughtful design with client input. So now when Focus Ireland is going and we're developing properties, we're developing that in mind. What can that do? What can the property that we're giving this person? That's very important for Housing First. What can we do to make this as impactful as possible? But the physical space is the foundation on which our relationship builds, on which the pathway out of homelessness is built. That's the anchor to this. The other thing is that in time, you need time to build relationships. The people that we're working with have a long history of homelessness, have a long history of trauma, and you need time to build that relationship of trust, that relationship of understanding. You must also recognize that any contact is a space for opportunity. Any contact, and you don't even need to apply this to Housing First. You can apply this to your own life, to any project, in any relationship you have, to recognize, and particularly in times of pandemic, that recognize that any space is an opportunity to enhance a person's life, to make them feel better about themselves, to make it worthwhile. It's positive human contact is key to that. Also, a space of opportunity is recognizing the incredible resilience and strength it takes to survive homelessness, or to be homeless, or to live on the street, and to recognize that as a strength. And I think another key thing is to validate the cognitive and physical effects of trauma. So and to realize also that the person's behavior is a way of communicating. So you're right to feel the way you feel because of the trauma that you've experienced. And that's okay. And I think it's important that we let people know that. So the next couple of slides is going to show you about how we kind of turned the physical environment around. So this is an area of Cork City where we would have originally have had our Focus Ireland office. It's down a back street. It's very close to an A&E department. It's also very close to an outpatients department. So there's a lot of sirens. There's a lot of, and as you can see, there's a lot of, now this area has become regenerated since these pictures were taken, but that's how it looked when we moved there. So there was a lot of stuff. And also as well, either side of it, it's a very narrow lane. And either side, the buildings are quite high. So it feels very enclosed. But we know that light and space are important for people who have experienced trauma. So basically what I'm saying, it wasn't a very inviting place to go to. And you can see from our office that we had, bars on the doors and stuff like that. And it was sending out a message that we did not want to send. So what we did was we moved the office. And also the thing about it is homeless people are always used to being on the margins of society. And where our offices were on the margins of the society in Cork City, we had to, do something about that. We had to rebel against that particular kind of notion that this is where homeless services should be. So we moved to the centre of Cork City, to the financial street in Cork City, the busiest street. It was an open, bright office. No bars in the door, straight in as normally as you would expect to engage in any sort of service. There's no barriers. Obviously, this is a pre-COVID picture because there's no screens there. But so light, the paint, everything about how you structure your environment is important, even down to the pictures on the wall, everything. So this is just to enhance, to encourage people to engage in the service, to invite them in, that this is a peaceful, calm place where you can feel safe. So the office is open plan, so that's support for staff. And this is an interesting part here, because this is the area where you can sit down, have a cup of tea and have a cup of coffee. The biscuits on the table are a vital part of this whole process as well. But also outside, you'll see that there's a garden, and the garden is very bright and it's light. And sometimes the sessions or one-to-one work needs to happen out there because of the space and the light that it gives, and people feel a little bit safer. So everything is taken into consideration. So this is the kind of the quality of an inside picture of one of the apartments we've had. Our founder, Sister Stanislaus Kennedy, would always say that you can't give broken people broken things. So we give them the best that we can provide in terms of the accommodation and the furnishing within that. And that's it. And we try to make it as homely as possible and give people a sense of pride in the place that they now have. To finish on saying that, the key thing is compassion and understanding and patience and kindness. And that, that's where you start with your pie. Pie doesn't need to be a huge massive organizational change. We started it simply by doing reflective practice right across all the aspects of the organization. And we're slowly building it out like you throw a pebble into water and just concentric circles. That's how it's working for us. But the key thing to remember, what you must bring into your practice, in no matter where you are, whether it's Housing First or anything else, is that the antidote to trauma and the experiences that our service users have experienced is kindness, compassion, understanding, patience. They're the key elements. And I think that's me. Sorry for rushing through it, but I was stuck for time. Thank you very much.
No problem, Jared. Thank you very much. And I think we can all see very clearly how using a psychologically informed environment can work hand in hand with Housing First in terms of the needs of the customer that are presenting to us, and indeed how we set up our services to help people through exit homelessness, often through very difficult years that they would have been through. So thank you very much, Ger. What we'll do at this stage is we will now move over to listen to Gary Neal's presentation. Gary is the Assistant Director of Rock Trust. And I suppose a little bit of information about Gary, it was while he was working in retail management, he struck up an unlikely bond with a homeless man named Tony, and life on the streets had robbed him of his hope, and soon it was to rob him of his life. This had a profound effect on Gary, and he began volunteering at that stage in Rock Trust. And he was fortunate enough to get a paid position with Rock Trust and began a career of over 20 years working with youth in homelessness. So his initial dream of helping one person or one young person grew to dozens in his role as a support worker, and 10 times that as a manager. And now in his new role as the assistant director, he's dreaming big, and he has dreams to end youth homelessness for good. So Gary's time at Rock Trust has seen him working across many frontline services in terms of delivery and operational. He's worked in supported housing, visiting support, and the Housing First for Youth services. He has joined the senior management team at Rock Trust as an assistant director, and Rock Trust aims to end youth homelessness by delivering services, influencing policy and strategy and practice. So without further ado, Gary, will you start your presentation, please?
Certainly. Thanks, Niall. Good morning, good afternoon, everyone. I guess I should start by saying I don't consider myself in any way to be an expert on psychologically informed environments, and I think that's one of the reasons I agreed to do this today. I think what I'm hoping to get across is the fact that it doesn't have to be really complicated and you don't have to be an expert. So hopefully, when I explain a little bit about how I led on creating a psychologically informed environment at Rock Trust, that will be reassuring for anyone who's embarking on that journey. How did we get started on our journey to become a psychologically informed environment? Well, it all started at an organisation away day. So our chief executive gave an input to the whole organisation, and she highlighted some of the concept of PI, and it all sounded really exciting and really great. And I think everyone left really enthusiastic, and I certainly know I did. And then I was kind of pulled to one side in a meeting and told that I was to take the lead on creating a psychologically informed environment. And then the reality sunk in that, oh wow, okay. So how did we go about doing that? Well, the first thing that we did was I tasked all the managers of the service delivery teams to identify PI champions from each of the teams, from all the different projects. And they set about their task and done some initial research. So they've done some online work. They spoke to other organisations who were working in this way. I guess that work all culminated in a visit to St Basil's in Birmingham, England. So a group of staff went down to Birmingham, shared some learning with the staff and the service users of St Basil's, and what we got from that was we got a team of staff returning to Scotland, really, really enthused, really, really excited, full of great ideas and huge ambition in terms of what they had heard from St Basil's and the impact that creating a psychologically informed environment had on the staff and the people who were using the services of St Basil's. And the first thing that the group reported back to us was that if we were really going to make this work, it wasn't enough just to have the frontline staff who were doing the face-to-face work with service users, as Ger alluded to earlier on. It had to be an organisational approach. And so the first thing we did, we identified champions in all the different parts of the organisation. So from the admin team to the fundraising team to the finance team. And we established what we called a PI working group. And so as well as driving forward the work that we were doing to create a psychologically informed environment, we kind of stressed to the PI reps that it was really their role to take on a bit of a leadership role within their own team to make sure that they were challenging their own team if there was anything that was going against what we were trying to achieve, but also that it was their role to feed up from the team if there was anything that was going on from management level that was kind of going against what we were trying to achieve. And quite quickly, actually, we began to see some changes in the behaviour and the language that people were using. And it was great as a manager to see that something that we had tried to do a lot of at Rock Trust over the years was to encourage people to be more reflective and to give feedback. And I think people had become really comfortable with sharing positive feedback, but a lot of people were much less comfortable giving constructive feedback. But what we found was that once people became familiar with the concept of PI and started thinking in a much more trauma-informed way, they found that a really easy outlet to actually give some critical feedback to their colleagues. And what you would often hear if you went to one of the offices, you'd often hear another staff member challenging someone saying, well, that's not very PI, or do you think that could be a little more PI? And it was a really nice way. It felt like a really safe way that people actually started to challenge each other about their own practice. And so that was the first meaningful change that we began to see. And I suppose then we reached the first hurdle. I suppose as the person who was asked to lead on this work, and I guess as a group, I think we started to think, how far can we go with a lot of enthusiasm and a lot of passion before we get found out that we actually don't really know what we're talking about here. And so there was a few months, if you like, of procrastination where we didn't really make an awful lot of progress. And I suppose the breakthrough for us was discovering the work that Robin Johnson pulled together on the PILink website. And the link's in the slides there. But as Ger said, anyone who's not familiar with it, it's an amazing resource. And that's something that really helped us kind of kick on to the next level. And the first thing we identified that was going to be helpful for us was to do some training for the PI reps, just to make them feel a little bit more confident. And so we arranged some training, and then we felt we were at the stage where we wanted to carry out some PI self-assessments. So the way we did that is we used Robin Johnson's Pizzazz self-assessment. And, these are the 5 different areas that Ger alluded to earlier on. So I won't go over them again, but Those were the areas that we agreed that we would assess ourselves on as an organisation. And again, Jer's already alluded to these, so I won't spend too long speaking about them. So how we did this was each team spent half a day within their own team, and the PIREPs took a lead on carrying assessments. And we used a scale of 0 to 10, so 0 being poor, 10 being advanced. And what each team did was they scored themselves on this scale to say how well they felt the individual team was performing in terms of becoming or being psychologically informed. And the way they did that was we asked what things are helping us to do well in this area? What evidence can we bring to back that up? What things are hindering us in this area? And again, what evidence is there to back that up? And then what can we realistically do to improve the score? And I guess realistic is quite an important concept there, because there's no point making plans to do things that you can't achieve. It really has to be something that's realistic. So that was something that we really kind of made sure that the staff were really clear on. And from those, we came up with some PI action plans. So each team had an individual action plan that laid out their tasks and their goals that they felt would help them become more psychologically informed and see that score increase. And what we noticed was there was quite a lot of themes emerging from individual teams, that rather than have all the teams working separately, we kind of gathered those together in an organisational action plan that kind of swept all those common themes up. And we scheduled in a 6-month review so that the teams could review progress, they could do a reassessment of the scores, and then they could update the action plans. And we continue that to this day. We have ongoing 6-month reviews, we update action plans, and most importantly is that we make sure that we're sharing that with all our colleagues. We make sure we're sharing the successes, but we also make sure we're sharing the challenges. And in the first few reviews across the board, I think we've seen scores increasing every 6 months. But as new projects emerged and as new staff came in and as new challenges present themselves, some of the scores would fluctuate, they would go up and down. That wasn't a bad thing, that was just an opportunity to say, okay, what do we need to do to try and get the score back up again? And I just wanted to finish really by pulling out some examples of the impact that had, not just on the services, but also on the staff. And so one of the first tasks that came from the very first action plan was, in my team, that we asked staff to come into the building and imagine it through the eyes of a young person who was accessing the building for the very first time. And I actually did this. It was a really useful exercise. I'd encourage anyone who hasn't done it to actually do it, because it was really, really eye-opening. And interestingly, I think we probably had the opposite problem than the one that Jer kind of described earlier on. So our office in Edinburgh is in, quite a grand street. It's the kind of street where you might expect to see paparazzi camped out if there was a minister or an MP involved in some kind of scandal. It's really one of those kind of streets. And so as I walked along it, I thought, this is probably not the kind of place that most young people would hang out, certainly not most young people that we work with. And then you get to the office, and the office has got one of these grand kind of stone staircases that leads up to a heavy black wooden door with a brass door knocker and a brass plate on the outside, which again, not the kind of place that most normal people would have any reason to go to. So, realising that could potentially be quite triggering, would certainly probably be quite intimidating for anyone visiting that building for the first time, never mind someone who may be distressed or upset or feeling apprehensive in any way. And so once someone had navigated that initial trauma, we would invite them in, and one of the receptionists would invite them to take a seat in the entrance hall or the vestibule. That was a rather cold space. It was drafty. It wasn't very inviting. It's a busy space, so there's staff coming up from the basement, there's staff coming down from upstairs levels, there's people coming and going all the time. And the young person would sit there waiting to see who it was that was going to come and see them. And I guess that must have been not ideal experience. And the reception room itself, it wasn't a particularly inviting space. We had partitions up, we had screens up, not because anyone felt that the staff were at any kind of risk from the young people. It was all done back in the day when we thought we needed to protect people's confidentiality, because there was finance staff dealing with payroll, and they were handling some sensitive calls and dealing with some sensitive information. So it was all there for very practical reasons. And the only reason we ever sat young people in the hall was because there wasn't any other space in the building that we could use for that. But from carrying out that exercise, it became really clear that we needed to do something we really needed to address that. And so what we did was we didn't have any space in the office that we could utilise. So we had to be quite creative. So we moved some of the staff around in some of the offices on the upper levels of the building. We also created a few hot desking offices to free up some space. And what that meant was that the admin staff and the finance staff could move upstairs, which created a lot more space in the reception office. And we were able then to get rid of all the partitions and all the screens, and we were able to have nice comfy sofas, and we were able to offer a cup of tea or a cup of coffee or a biscuit, but just more importantly, a friendly chat, just someone who was there just to say, good morning, how are you doing, get a seat. And the impact it had was immediate. Our service user consultations would often flag up that people felt quite scared and quite intimidated until they got to meet their support worker, and then they felt really welcome and safe. And what we began to see right away was people said their initial immediate first impression when they got to Rock Trust was that they were made to feel really safe and really welcome by the reception staff, who gave them a hot drink and just chatted to them. So that was a great win. But then that has a knock-on effect, because what came up at a later PI assessment was that some of the reception staff were, although they were enjoying having more interaction with the young people, there were times when, if young people were coming in and they were particularly distressed or upset or angry, the reception staff felt a little bit unclear or unsure on how to deal with that. And that was causing, at times, them to feel a bit unsafe, but just to kind of feel like they weren't able to do as much as they wanted to do. And the action from that PI assessment was that it would be really helpful for the reception staff to have some additional training. So we've done some trauma-informed practice training. We've done some training on how to deal with challenging behaviour. And none of these things cost any money. This was all skills that we had in-house. And so really, all it cost was the time away from the desk for the reception staff to go through the training. And again, the impact of that has been incredible. The young people are getting a much better reception when they come into the office. The reception staff feel much more safe, and they feel much more job satisfaction. The fact that if a young person comes in and they're distressed, they're able to give them that basic level of kindness and have a relationship there with the young people just to make them feel safe and feel calm. Yeah, I think that's it. I just wanted to give a couple examples of how that's had a really quick impact for very little cost, if no cost at all. And hopefully, if anyone's about to embark on a task like this, it's reassuring that it's achievable if you break it down into kind of small steps. Thank you.
Thank you very much, Gary. That's a very, very interesting overview on how to, I suppose, implement a PI strategy or a PI service into what you're currently doing. Just to say to everybody that the webinar chat is open for questions. If anyone would like to put a question forward, that'd be really, really great. But in the meantime, we have one or two questions that were sent in prior to the webinar going live. So with Ger and with Gary on standby, I'll go through the first one if that's okay. So first question, interested to hear opinions on the danger of setting clients up to fail. Organizational growth is important so we can expand Housing First services and reach as many clients as possible. But do we not also have an ethical responsibility and duty of care to our participants that organizational growth does not come at the expense of the support available to participants? Okay, that was a mouthful, but I think what we're trying to say is, are organizations growing too much, and should we be looking at what the customers need before looking at organizational growth in relation to the likes of PI? So Gary or Ger?
I guess what springs to mind for me is that this is exactly the kind of situation where having a framework in place where you're carrying out regular assessments to see where you're at, where your psychologically informed minds could be really useful. And we've certainly seen it as an organisation at Rock Trust, where we have expanded over the last few years. And we have, certainly even just in the teams that I've been involved with, we have seen some of those scores come down. And that's been a good opportunity for us to look at that and think, well, okay, we have got a lot bigger. We've got a lot of new staff who maybe are less experienced. And how can we make sure that we get them up to a level where they're able to provide the same level of service to the young people as their predecessors? It's an opportunity. If someone's expanded, it's an opportunity to look at where you're at and how you work on that In terms of failing young people, well, I'm speaking from a Housing First for Youth perspective, I think most of the young people who we've engaged with in Housing First have either already been failed by the system, or there's a good chance that without an intervention like Housing First, they're likely to be failed. And so take the lead on the principles Housing First, and as long as you're not compromising on them, it's about finding a way to work in a way that works for the staff and for the service users.
Thank you, Gary. Jared, do you want to come in on that one?
I think we have an ethical responsibility for ensuring that people don't fail, because people have been failed in the past, as Gary has already said. And if our organisations are getting bigger and getting unwieldy, and it's putting the success or if that's becoming before our customers or before our service users, then we had to sit down and have a serious think about, are we doing actually the right thing? I think that's why I think psychologically informed environment is an excellent model to introduce into any organization, because it's a whole organization thing. So if everybody in the organization is looking at it from a psychologically informed viewpoint of compassion, understanding, patience, where the service user is coming from, what their needs are, I think that will, prevent you from failing that individual.
Thanks, Chair. We have a question in from Mike. Given the concentration on welcoming spaces with no barriers, what challenges has COVID-19 pandemic raised in delivering PIE? So I think we all agree that the environment is hugely important, and for it to be welcoming and no physical barriers or constraints. But obviously with COVID-19, we do need screens and plastic screens, and we've seen it through all of the different, I suppose, shopping outlets and services that are run. So from your perspective, has it impacted?
Certainly has. And I think the idea of there's no fidelity in terms of PIE. So as a model, you adapt that model to whatever circumstances are presented to you, either organizationally or externally. In the absence of a vaccine, all we can do is mitigate the effects of the pandemic. And we do that so our Housing First projects, they still have one-to-one, but it's done in a very restricted way, following health guidelines. So the contact is there. But the key, so social media has played a huge part in our responding to people, and particularly people who have their own accommodation and who would have left emergency accommodation, despite how dysfunctional you might think that is. There's still a community there, but they've left that to move into their own accommodation, and that can be quite lonely. So the key thing is social media. So the importance of making regular contact via phone or other types of social media has been crucial to it as well. But also letting people know that you're there for them, that all you are is a phone call away, that you don't feel that even though you might feel lonely, you don't have to be alone.
And it would be fair to say as well that instance of people dropping into services has reduced significantly with COVID, because I think a lot of services are now using an outreach approach and visiting people in need to save them travelling and to move around. Gary, do you have a perspective on that?
I think what we tried to get across to our staff and to our young people was that although we were working in a socially distanced way, we weren't working in an emotionally distanced way. And so those telephone calls or those video calls, those were the one-to-one sessions. It wasn't a poor alternative. It was a different way of the young people getting what they needed from that interaction. Yeah. We've been challenged, but the staff they've been doing far more outreach work than perhaps they would have done previously. I guess in some ways, working exclusively with young people and the reliance that we've come to have over the last few months on using technology has probably worked in our favour, because a lot of the young people we work with, we've been able to provide smartphones. We've been able to get funding to provide SIM cards with unlimited data and calls, and so we've been able to keep in touch with young people. There's an argument to say for quite a lot of young people that has actually worked very well. They've almost got support at their fingertips, although they always had that before anyway, but weren't so inclined to use it. But I don't know if that felt like an imposition, or that that the time out with their one-to-one time was somehow someone else's time. But we're seeing a lot of young people who are engaging much better in this new way.
Good point. And I think technology is going to be key in the way our services run in the future. It's good to be able to embrace that. Question in from the Q&A box. Are there any specific considerations in place around PIE when supporting women? Now, I'm not sure if they mean in a Housing First context or in a female-only service, or I'm not sure what that means. But I'm hazarding a guess that if you are setting up a service to look at the emotional needs of people, and certainly looking at it from a trauma-informed way, you would take specific considerations and you'd make sure that it meets the need of the client group that's presenting. So I'm not sure would it be true to say the same in Housing First, because Housing First is male and female service by and large. Any thoughts?
It's not something that we've really had to do any work around, to be honest. That's my short answer. But if there was a need for that, then I would like to think that would get picked up in the regular reviews and the assessments, and then if we did need to act, then that would be the catalyst to make us respond to that change.
In kind of the initial stages of trauma-informed care and stuff, would have come from, the experience of Vietnam vets coming back from the Vietnam War. Then that would have, the learning there then moved into domestic violence projects and in terms of how to deal with trauma. So historically, it would have been perhaps started out as a female focused, but I suppose the way we're working is that there's not a specific male-female compassion. There's not a specific, understanding, or you apply all those basic human qualities to whatever person appears to you, and if it is required, then you adapt the service to meet the needs of the people who are presenting.
And that's the basic principle of PIE, really, is looking at who is presenting and what's the best service you can provide for them. Next question in for the panel is, how do we balance organizational growth so we can continue to uphold Housing First principles if large-scale investment in staffing and resources that is needed is not being provided? So how do we meet the demand if the funding isn't there?
Yeah, I think we need to be guided by the Housing First principles, and I think as an organisation at Rock Trust, if we didn't feel that we could work and stick within the principles, then if funding was going to compromise that, that we couldn't do it, then we wouldn't do it.
I also think that one of the principles of PIE is learning and inquiry. So it's evidence-based research. So there is quite a considerable amount of funding, particularly in Ireland, for emergency accommodation, and quite a lot of resources are spent on emergency accommodation. If you have evidence-based research that shows you that Housing First and introducing a psychologically informed environment has better overall economic as well as social benefits, then that's what you'd use your learning inquiry for. Your evidence basis is to encourage the redirection of existing resources to more effective models.
Absolutely agree with you, Ger. That's true. In relation to the Housing First Fidelity and PIE, can they work hand in hand? Is there any fallout or difference between trying to have a Housing First, proper Housing First Fidelity, and implementing PIE in all of the 5 principles of PIE?
I don't see a contradiction at the moment between the principles of Housing First and the principles of PIE. I think they're quite complementary, in fact, and easily adapted. And I suppose while there's a fidelity to the model in Housing First, the same fidelity does not apply in the psychologically informed environment model. So you can adapt that model to meet the principles of Housing First, in my opinion.
Back to the panel questions again, and another focus on organizational growth damaging our ability to create and maintain PIE. So vital participants in the sector and staff working with them. So is organizational growth damaging the work that we're doing with customers on the front line? Seems a theme coming through in relation to organizations growing so big that they lose sight of why they were set up in the first place, I suppose. Any comments on that particular one?
I suppose it comes back to the learning and inquiry kind of aspect of the PIE. And I suppose it's our responsibility to be consulting with service users to get their input and service design to be evaluated, and to be really getting into a bit of depth about some of the aspects of the practice, so that we should be the ones who are informing the decision making at national and local levels. And that will be a challenge. Commissioners are always going to try and get the biggest bang for their buck. And I suppose it's our responsibility as kind of leaders in PI and Housing First to be challenging that and to say, like, this might be more expensive on paper, but the longer term cost benefit, in terms of the cost to health services and the criminal justice system, it's actually, you're going to make a saving. But I can see the challenges in terms of commissioning. Commissioners will always try and drive down the price.
It goes back to, why is the organisation growing? What need is it meeting? And are you growing just for the sake of growing it? Are you growing because there's an actual benefit to the service user? And PI would allow you, if you have a PI entrenched in the organisation, it would allow you to make that assessment. But also go back to Gary's presentation, which was doing the assessment of where you are in terms of a psychologically informed environment. Part of that assessment is, well, what are we doing now that we need to change or be more efficient at doing, or need to get rid of completely and use those resources better? So it may not necessarily mean the organization is growing, it's just the organization is going in a different direction because the assessment or the feedback we're getting is telling us that this is a better way to use our resources. And then it goes back to Gary's point about it again, which was the evidence-based and inquiry, that we shouldn't just be growing because the people who are commissioning the services want us to work in a particular way. We need to be using that evidence-based research and that learning and inquiry to influence their decision so that they are making better choices for our organizations and therefore ultimately for the people who use our service.
So it's a win-win if you take all those pieces and put them together. It should work perfectly. Okay, is there any more questions coming in from the chat? I don't think so. If there's anyone who'd like to ask a last question before we get ready to wrap up, I think we've 3 or 4 minutes left before we finish. Please do so. In the meantime, just to say that the Good Platform Hub are also planning some further webinars early next year and into the summer and the latter half of next year. So we're looking at a couple of areas in terms of coping with stress in the workplace, and we're working with customers in Housing First. Also, we want to explore a little bit about working from home and how this has worked in terms of the flexibility, the culture, what the new norms look like when you're supporting people from a Housing First perspective in this. So we will be having those in January, February, and then towards May. So just to give you a little bit of a heads up in terms of what we're planning for the coming months. While waiting for questions to come in, Samara comes question come in from the group. Do you think physical spaces and environments for homeless women could have different needs and features? Thinking of different kinds of trauma they experience in life in the streets. Well, I would say straight away, absolutely. But I'm going to refer to Gary on this one first.
It's not something we have a huge amount of experience on, but I suppose a recent example, and it wasn't actually in Housing First, but it was in one of our other shared models that draws on a lot of the principles of Housing First. And we had some discussion around should we have a small shared flat model with 2 young people who would live with a volunteer, and should we have a female only one? And there was a bit of discussion around that, and it was interesting because there had been a couple of young women who were young care leavers who were both identified as being particularly vulnerable in terms of vulnerable to predatory males, and there was concerns about the risks too, and I guess the risks in general. Should we consider having a female only flat? And we decided actually no, we wouldn't, because there was a potential there for potentially putting 2 young women in that situation with a volunteer. So it wasn't a huge amount of supervision, and there wasn't a staff presence there. There's the potential for putting both young women at greater risk. And so in principle, the idea of having a single sex flat seemed like a good idea, but actually when we really thought about it, and I suppose we got into the sort of psychologically informed thinking there, and it's like, actually no, this is not a good idea, because potentially put them at risk. But also, if one young woman was making great progress, it just didn't feel right.
Jared, do you have any comments on that one?
We have been having discussions around that in Cork City, where I'm based, and there is no specific female service, particularly for singles. There is for families and stuff, but not for single females. And they have to go into a shared hostel with, sharing hostel with both males and females. And it has been identified as a significant need because of the level of trauma that some of the women have experienced. and it's to create that, more secure and shared environment, which a single gender project may engender.
Thank you, Ger. Thank you, Gary. There's just one question Kim has asked. We can get the presentations out in email. I'm sure that's doable. Yes, Gary. Thank you very much for your presentations and your comments and sharing your time. It's been great having a little chat, because that's kind of what it felt like. And we look forward to having more webinars in the future. So I'm going to pass back to Samara just to wrap up. But thank you all for listening.
And thank you, Niall, for taking on the moderation role. That's great. And I really appreciate how many people had questions and clearly were really interested in. And I like, just thinking back to one of the things that was said at the beginning, I like the idea that you said that you can start doing Pi. You don't need to shift your whole organization first, but you can start yourself with your colleagues in a sort of small scale way and build it in, which I think it gives you the ability to sort of empower yourself and empower your colleagues to move along that journey. And I thought that was a really interesting remark, and I hadn't thought about it that way before. So I thought that was great to hear. And as Niall said, all of the presentations and the recording of this webinar will be available on the Housing First Europe Hub website shortly. Check back sort of this time next week or in a few days, and it will all be there for you. And it's great to come together and have a feeling that we're not quite so far apart as the current situation is making us feel. So thank you all for being here, and thank you especially to Claire, who does all the behind the scenes work and make sure we're all on time and have got our things organized and make sure it runs so smoothly and nicely. So thank you, Claire, and thank you, Tina, for coordinating this group. It's been great. Thank you all.